The economy, coming from South Houston, their states are different. They provide nothing for you. And we have been in this about a little over close to 20 years. It used to be like every other Friday in offices, Saturdays, free clinics. Afterwards, we started with one clinic as a part of Social Committee of Islamic Society of Greater Houston. Then the attorney said afterwards, they paid for a year, then they said there's liability issue. So their attorneys told us not to support. So we continued for a couple of years. Then it has we got approved from IRS as a non-religious tax-exempt organization, Houston Shifa Services Foundation, in May 2002. And we expanded. City gave us a grant, and on the basis of that, Islamic Society leased the land for 15 years. So we got 1.5 million grant, free clinic standing there, and that has been running Shifa clinic there in one southwest zone. Then we opened another clinic, and again on masjid premises, but it is trailer belongs to Shifa Foundation. And the most important thing is, in starting the clinic, there must be paraprofessionals, manager. If you don't have that, physician will be of no help to you. We failed in the beginning because we got the trailer, everything ready, but manager. So in each of our 4 clinics, there is a manager, medical director, as well as manager. Manager, they remind the physicians, volunteer physicians. We have all, until about a year and a half ago, all volunteer physicians on weekends. But for the past year and a half, in one clinic, we have a paid physicians, 5 days a week, 6 days a week, 3 hours every day, and paraprofessional also. In the other 3 days a week, nurse practitioner. There are in 4 parts of Houston, and now we are at a state. We used to be $5, but we push them, charge $20. It is never free, $20, and then lab charges also. Labs then discount, they make money. Most of our clinics now, they are in the positive. And the only thing where we have now paying physicians, it is not easy there. We have to be fundraising, and it is something that cannot continue. So we are in the process of organization, making a not-for-profit organization. I say Texas Children's Hospital in 1905 started by church as 3-room outpatient clinic, and then gradually not-for-profit. They are still not-for-profit now, and they have 20-story building. They get millions of dollars. We have to proceed in that direction.
Can I ask you a question?
Yes.
What do you do about emergency rooms and hospital patients who have to be hospitalized?
Always we have referral systems. We have a one group in clinic. They will enable, help them educate, get gold card, and how to get government services.
How does that? You mean it's like?
And in the Texas, anybody can go to any emergencies. We have no money. They must
Provide service.
Yes, provide service. So there is no. So many of time our patients, they do not know customers. So we tell them that. Okay, so educate them, and this is a part and parcel of one department that will educate them.
My question was, if somebody needs elective procedures, what do you do then?
Yes, then we have the physicians who will, with concessions, will take them. We have a dental clinics also in 2 of the 4 clinics, and eye clinics also, and a lot of volunteers. And we are also having the same problem, volunteers dropping. I go in one clinic once every 4 or 5 weeks, pediatricians, but my insurance will not cover for other specialties. And malpractice, we do have some overall for 4 clinics, but there are difficulties in there. And so in ultimately have to in that direction we are using electronic records also. Fusion, it is a free practice fusion that is free in there also. And now coverage is also for Medicaid. We are applying for like a NPI number for Shifa Foundation, and for that, so we may have to have another organization. It is a charity, public charity, tax-exempt organization, 501c3, but the other one will be like a not-for-profit. So with a certain percentage, we say 30%, maybe 20%, we will support from one pocket to the other, pay for those patients who cannot afford to pay.
But you can still keep it under the 501c3 though.
This is the one we have to check with our attorneys.
Just like the
This is our
FCC
next
dilemma.
meeting.
Yeah.
Say our board as well as composition is, we had first Houston Shifa Services Foundation. It included 4 free clinics and also domestic violence, and also ex-offenders when they come out for rehabilitation, and also low-income housing through the federal government at CHUDO. We are approved, and then federal government funds money to the city. City gives to us, and the investors, they get money from us. So we had a share 17%. We got last year over $100,000 that way, and this is. But there is one requirement in that 1/3 of your board of directors have to belong to low income, and they were very inactive. So we have separated that Houston Shiva Services Foundation and moved to another organization called Shifa Healthcare and Community Services USA Inc. And what we call is Shifa USA, and that looks after all the 4 clinics and these other 2. And city has given us now a grant about 6 months ago for $950,000 for domestic violence, because we bought 3 years ago a house with cash and everything, and they say that now new within 18 months it will be built completely. It is in the process of. So board is very important. In our board we have 2-3 non-Muslims also. So we are having a relationship with Islamic Society of a strict business relationship. Non-Muslims, when they come, they say, well, you are all your clinics are in the mosques, and you are just wearing a different hat. You are deceiving. But with the clinics, we are trying to get them the strictly business deal.
Next one, please.
Yeah, liability issue. Yes, we went through that, and we had to get about $5,000 per year for these 4 clinics. 2 of them are weekend, and the other 2 like that. And when we said ex-offenders, that was approved by the state. We call it SEHR, Shifa Alternate Housing Resource. State approved that they will stay there. But that alone is very expensive insurance. They will not include that.
So 5,000 is good.
Please come.
5,000 was good. And yeah, also physicians, like as a pediatrician, I will see only pediatric. But for internists, I say the only thing I can do is review their lab reports, and tell them. So that's, I think, some of the things, because they are more busy internists or family practice patients.
That liability is for the facility, right?
For the facility,
Physicians are covered.
it is liability for the for the physicians those who are seen. Yes,
Malpractice. Is it malpractice?
that it is. Yes.
And the county doesn't give you malpractice-free malpractice?
Good Samaritan, there is a rule, but I think many they hesitate. I checked with my malpractice. They said if it's a charity clinic, I go there maybe like 1 day a month or something. They will cover so long as I keep my pediatrics. So they will cover in that way. Every physician in his own specialty will be covered. We have specialists coming in those clinics once a month, and health fair and all those things.
So what happens to my malpractice now? And carry over. Can I answer that?
So basically, are you in Virginia?
Yes, I'm in Virginia. I'm in Fairfax and I'm like.
She's a pediatrician who works in Fairfax.
Yeah, you're good, good.
Yeah.
So it's forever.
Yeah,
Yeah, I told her.
So in a nutshell, that's where Division of Risk Management with the state treasury, they will provide the liability coverage. It's blanket coverage for any licensed provider, physician, dentist, nurse, practitioner in the state of Virginia. So very few states offer that support. So that's a statute that's been there for a